What are the symptoms of paranoid schizophrenia in women? Have you ever wondered how paranoid schizophrenia affects women specifically? This condition is a subtype of schizophrenia that brings unique challenges, especially for women. Let's break down the symptoms that are commonly seen in women with paranoid schizophrenia. One of the main symptoms is delusions. Women often experience paranoid delusions, which are false beliefs that someone is trying to harm or deceive them. For example, a woman might believe her partner is unfaithful without any evidence to support that thought. These beliefs can be intense and distressing. Another significant symptom is auditory hallucinations. This means that women may hear voices that others cannot hear. These voices might comment on their actions, give commands, or even have conversations with one another. This can be very confusing and frightening for those experiencing it. Interestingly, women with paranoid schizophrenia often maintain clearer thinking compared to other types of schizophrenia. This means their cognitive function can be better preserved, especially in the early stages of the illness. This can sometimes make it harder for others to recognize that something is wrong. Emotional and behavioral symptoms also play a role. Women may show more physical activity and can sometimes be more hostile than men with the same condition. They are also more likely to experience anxiety and depression alongside their psychotic symptoms. This combination can increase the risk of suicide, making it essential to address both the psychotic and mood symptoms in treatment. On the other hand, women with paranoid schizophrenia tend to have fewer negative symptoms. Negative symptoms include things like flat affect, which is a reduced emotional expression, and social withdrawal. Women may appear more socially engaged than their male counterparts, which can mask their condition. The age of onset for women is also different. Women typically develop schizophrenia later than men, often in their late 20s to early 30s. This later onset can influence how symptoms present and the overall course of the illness. Because women may be more socially active, their symptoms can be less noticeable. This can lead to delays in diagnosis and treatment. Awareness of common paranoid themes, such as fears about infidelity or being targeted, can help clinicians make better assessments and tailor interventions. In summary, paranoid schizophrenia in women is marked by strong paranoid delusions and auditory hallucinations, with fewer negative symptoms compared to men. Women often experience additional mood symptoms and may have a later onset of illness. Understanding these patterns is essential for recognizing symptoms early and providing effective treatment.